It is time for us to say enough is enough. When the ugly incident and the ugly responses to the death of Junior Pope, I felt that at what point can we talk about this? Now, it happened to be the deputy controller of custom went to work in the morning. The news got to the family that he is no more. Is that the first? No. Will he be the last? I can begin to say no. This has happened over and over again in Nigeria, and we can't continue living this way. I know most of us have our faith in that, but it says affliction shall not rise the second time. Nevertheless, it's expected of you to know why the first one happened so as to prevent recurrence. And I consider it very important for us to look at who could be responsible for this. Friend, we didn't get to know the detail of that because the final diagnosis was not given out. Be that as it may, if this very fellow is a diabetic person, maybe on insulin, he never ate before going into that particular presentation. In any form, within 5 minutes, glucose doesn't get to the brain, or oxygen get to the brain, no matter how hefty this fellow is, it must be on the floor. It must just be down. Also, this person may have hemorrhagic stroke because of neglected hypertension. But majority of these deaths happen when there is a problem ongoing in the heart. Friend, it is time for us to know and understand that life begins with the heart and ends with the heart. This your heart, it beats every day. Every day, 100,000 times. He's a very busy guy. You need to take care of it, friend. A scenario where this could be absolute possibility. The man may have heart attack, and in the process of heart attack, nobody knows what to do and how to respond. This guy passed, and that's why I have the opportunity here today to teach you what you could do. What you could do to save your dad, save your loved one, save your friend, save our people. When you know what to do them right. This man died of preventable death. Preventable death, I can tell you. So in a scenario where there is a blockage of the artery, in a scenario where that artery got blocked, there's a tendency, very high tendency, that this heart will not receive blood supply on its own, and over the time, the person may have breathlessness, chest pain, he may have a kind of feeling attack. He may even be having it even before now, but it doesn't matter. Friend, you can't see yourself going, you can't see yourself not being in position to feel well. And he said, he began to call Satan. Should we continue to wait for the Satan, so-called Satan, to finish all of us? You see your legs swollen? You see the agile you that used to be very strong and running up and down? You know, if you do a little thing, you are getting tired. And it doesn't call to you that something is beckoning you to come home. It's quite important that we give attention to this right now. Why we have buried many? Look at these ones. These ones had the same scenario this man had. They are still alive. This doctor had a heart attack right in the house, and he was intervening for this one to be living. See a number of them. When we are burying the ones we are burying. I will show you something today, what you should never do when you see somebody on the floor. We will just gather and they say the person fell and nobody was doing anything. This very person died. How long can we remain in this kind of society? 2020, I realized that in the entire southeast and southeast of Nigeria, not even a single of this very machine called cath lab, this is heart equipment to make a heart attack. Or if there is issue of heart failure, you can put a pacemaker and all that. You know what? The entire place. And I said, yes, you know, some people say it's not my portion. This is what is in United States, that within 1 kilometer is expected there should be an intervention of this, but not one. I borrowed 900 million naira from Access Bank and CBN to put this in Accra. Somebody said, why should you spend on it? Where do you get the money? He's talking about money to make from others. What if not me? What if it's my loved one that in the whole regions of this dimension, not even a single one? And that's why today, this has saved this doctor, saved a number of them on that particular call. By and by, you should also understand, even though this is not readily available, number one thing is that, how do I prevent this? Please, get your ECG done. It will reviews if you have a heart disease, or if there is a blockage in the heart, or the heart is not performing. Most time people will get this done, they don't know what to do, they don't even understand the meaning. That's why we created this very number here. And see, if you have those your ECG, heart related, post it. We mobilize people that could be able to interpret it and send the result back to you. Go to your doctor as early as possible. You are diabetic, you are hypertensive. Please manage it alongside with your doctor. So manage it alongside with professional advice backing you up. This very fellow didn't just die. His family, the wife, the children, the loved ones, some in school, their destiny can be guaranteed today. We can say no to this and as urgent as possible. I want you to join me. Let me show you in a worst case scenario, which we can say let it not happen. But what if it happens? What can we do? And follow me as I show you something here. Now, this is one of the things that could happen at any given circumstance. Sometimes even when some caution have been taken, be that as it may, if somebody collapses around you, please don't run away. Don't run away. You can help. And how will you help? First thing you should consider is your own safety. How do I mean by your own safety? Check out what made this very person to collapse. Is it that something fell and hit him? Is it there is an electric shock somewhere? Or something? You look at the environment, pick up that observation. If that's okay, you now have to come. First of all, confirm whether this guy is lifeless or he's still breathing or something. He's just tired. Because a number of people can just get tired, all right? And what do you do? If this very person is still conscious, but is looking so weak, allow him to lie down flat, okay? And possibly at that point, there's nothing much you could do. Raise this very leg up for him. What is the importance? When you raise this very leg up, the blood that already sequestered there can be pulled down towards the heart and then towards the brain. This fellow can get up. This very fellow may start at least being supported until professional help comes. All right? Now, that is number one thing. Do not cluster the man. Do not go and begin to bring something that, hey, well, don't panic. They don't use panic to save people. Don't do that. Don't go and put something on the mouth. Don't go and rub something in the air. Then, in a scenario where this very person is no longer breathing, how will you know? You know by this simple thing. Look at this. First of all, you try to wake him up. Hello, sir. Hello. And he's not responding. That's what responsive. Second one, you confirm whether he's breathing. How will I know now that this very person, he may be breathing without me knowing small. And how will I know? Quickly, do three things intelligently. You can do it simultaneously within 5 to 10 seconds. Very fast. Now, with your ear, if this fellow is breathing something in and out, you will know. Okay? Your ear can know when this very person is breathing, whether air is coming out. But while you are doing this, let your eye also be on the tummy, because if he's breathing, you can see the heart also, the tummy also making some form of movement. In the same accord, if you know what we call Adam apple, somewhere here, all right? If you go this way or go this way, there's carotid artery that run up to the brain. If you check out the person around you, just place your hand right there. Okay? You will feel something pulsating. Boom, 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 boom. All right? It should be in a person if you know see your own. Don't die. Check out the person beside you right now. If you know, find that thing for him, tell the person to go and right away. Okay, now let's go, all right? On a lighter note, having been able to land this, so how do I do it within a space of 5 seconds? I can put my ear here. This very person, if he's breathing, the stomach, of course, you know, should be coming up and down. So while your ear is here in the mouth and within the nose and the mouth, your eye should be on the tummy, checking it out, while your hand, okay, will be able to feel that pulse. This can be simultaneously be done intelligently, okay? And you discover that this very fellow is not responding. What you should do, there is something that they say, call for help. The help is for them to get what is called AED, defibrillator. That thing they use to shock person. Where you find that for Nigeria? So if you shout, help, help, somebody will come out with olive oil. Another person will come out with anointing to bind demons and all that. Friend, this casting demons and all that is essential. Prayer is essential. But in a scenario like this, it does not help. You can pray while the right thing ought to be done should be done. You can pray to go and block him. If he don't, they waka, they go the other side, make them pursue and come back. But it is not for you to cluster this very fellow and be in position to be binding and loosing demons, because most times he says, no, it was somebody, it was this. Come on, stop. We buried enough, isn't it? Now, at this particular point in time, call for help does not mean to bring spoon and be putting in the mouth or begin to pour water. Because if you pour water, the water you pour here could be in position to get right there into the lungs. You kill them. You don't keep a person with that. Now, having been able to note that you shouldn't kill by doing any manipulation and all that, you start what immediately after you discover that this very person is not responding. Call for help. We are coming up with a technology which will make you to know what to do at any given time, even the nearest hospital you can reach. While someone is doing that for you, begin to do what they call chest compression. But how do I do this? Now look at me. This my hand, all right? I'm a right-handed person, which means I have right dominance. Some people are left, okay? So if you are right, that you are right, you place it on the middle of the lower side of the chest. Now listen to this. We are, some people believe that the heart is at the left side. No. It is only the upper bit of the heart that goes through, but the heart is centrally located. So in that case, you put your hand there. Now, the dominant hand first. This your other hand, you use it in lock this way. Now, check out now, I have my elbow, lock up this very elbow in order to give you the maximum strength you need. And you're gonna compress this up to 5 cm, that's deep enough. Forget about whether the bone will break. You are saving life. We can fix the bone later. All right? So at that point, having been able to put it, you press for 100 times to 120 times per minute. Now, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9. You just scream it. Push, 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 push. Don't mind how far. Keep doing that you are doing. Push at that one while you are pushing it 100 times. All right? The issue of mouth-to-mouth respiration, the American Heart Association currently established that you can do compression only. But if it's within your power and for demonstration purpose, of course, many people can use this right now. I put up this. When I push 100 times thereabout, I can quickly give a full blow while I continue right there. What are you trying to do by doing this? You want to compress that foam that is called the heart, that the blood is there. When you compress it, blood goes to the brain. Do you get that? The blood goes to the brain. By getting oxygen, this very fellow may open eye while the intervention on that AEDs and all that could come around. This you can also continue until the injury fellow gets to the hospital, and preferably on a hard surface to be able to give you that particular pull.